This is Chapter 1. This is an instruction manual. If you are interacting with a person with multiple chemical sensitivity, these are the rules. This is not optional. This is not a mental illness. This is a documented physical condition involving abnormal physiological reactions to environmental chemicals. Exposure can trigger respiratory distress, neurological dysfunction, systemic inflammation. Symptoms are real. They are measurable. They can last weeks to months after exposure. The primary treatment is avoidance, not exposure, not adaptation, not getting used to it. Avoidance of triggers is required to prevent reactions. Do not wear perfume, cologne, scented deodorant, fragrance laundry detergent. Do not bring chemical cleaners, strong-smelling products, synthetic odors of any kind. Do not assume a small amount is okay. They'll get used to it. Even low-level exposure can trigger a reaction. Air must be clean, non-contaminated, free from chemical odors. Environment must be low exposure, non-synthetic where possible, well-ventilated or outdoor. Contact materials must be unscented, non-treated, low chemical residue. Before approaching,
check yourself.
Clothing,
Detergents,
body products.
soap, deodorant,
If you smell like anything,
any chemical exposure.
if you smell like anything, you are a risk. If exposure occurs, the person may experience breathing difficulty, confusion, or neurological overload. Severe physical distress. Once triggered, the reaction cannot be immediately stopped. Symptoms can persist for weeks or months. This is not preference. This is not exaggeration. This is a physiological response to chemical exposure. If you are unsure, assume exposure is harmful. Err on the side of zero chemicals. You do not have to understand this condition. But if you are around someone who has it, you are responsible for not triggering it.
This is Chapter 2. This is the treatment. There is no cure. The only treatment for MCS is avoidance. Everything is contaminated until proven otherwise. Assume exposure. Act accordingly. Avoidance means removing exposure, not reducing it, not tolerating it, removing it. You do not enter most indoor environments, no stores, no public buildings, no normal housing. Indoor air contains detergents, perfumes, cleaning chemicals, synthetic materials. Air is the exposure. People are exposure before contact. What are they wearing? What did they wash it with? What products are on their skin? If they smell like anything, they are a risk. You cannot control everything. You cannot control the wind. Air moves, contaminants travel. Fuel vapors, chemicals, smoke. If the wind shifts, you are exposed. When approaching contaminated areas, use an M3 gas mask. Be aware, not all high filtration masks are safe. some contain powder residue manufacturing chemicals. These can trigger reactions. If a mask causes a reaction, stop using it. Do not assume all masks are the same. Some masks are lower residue, more tolerable. Do not give up the search. Contaminants attached to hair, skin, clothing. Exposure follows you. You can leave the area and still react later. Decontamination is required. Items must be isolated. Use containment. Sealed plastic bags. Ozone treatment when possible. Ventilate before use. This reduces chemical load. Decontamination is not perfect. Some materials retain contamination. Items may remain unsafe. Basic functions require control: water, clothing, sleeping, movement. There is no normal routine. Travel is restricted. Vehicles contain chemicals. Enclosed air builds exposure. Movement requires risk calculation. If avoidance fails, respiratory distress, neurological dysfunction, systemic reaction. Once triggered, and let it can last weeks to months. Avoidance reduces risk. It does not eliminate it. There is no cure. This is the treatment. This is chapter 2. This is how survival is maintained. This is chapter 3. This is what happens inside the body. Multiple chemical sensitivity involves abnormal physiological responses to low-level chemical exposure. The body becomes sensitized. Substances normally tolerated trigger disproportionate reactions. Exposure occurs through inhalation, skin contact. Chemicals interact with sensory pathways and cellular receptors. The body interprets this as a threat signal. The nervous system activates rapidly. Key pathways include trigeminal nerve, autonomic nervous system.
including vagal pathways.
The trigeminal nerve detects chemical irritation in the face and airway. The autonomic system responds with regulatory disruption.
This activation can trigger neuroinflammatory responses, heightened sensory signaling. Pain pathways become amplified. Signals that would normally be minor are interpreted as severe.
The airway responds. Constriction, irritation, reduced airflow. Breathing becomes restricted.
The reaction is not localized. Multiple systems activate. Nervous system, immune signaling, inflammatory pathways. This creates a full body response.
Once triggered, the response escalates. One system activates another, symptoms amplify. The body does not shut it down immediately.
Pain can be severe due to nerve involvement and amplified signaling. Facial pain, head pressure, systemic discomfort.
Some patients report pain levels comparable to extreme physical conditions, including childbirth.
The reaction persists after exposure. Hours, days, weeks, sometimes months from a single event.
Repeated exposure lowers tolerance. Smaller exposures trigger reactions. Sensitivity increases over time. The threshold drops.
Because of this mechanism,
The body cannot safely process exposure. There is no reliable way to stop the reaction once triggered. Avoidance is not optional. It is required to prevent activation of these pathways.
this is not psychological. This is a physiological response involving nervous system activation, inflammatory signaling, systemic reaction.
This is what happens inside the body. This is why avoidance is the treatment.
This is what happens inside the body.
This is why avoidance is the treatment.
This is chapter 4. This is progression. This is how it develops. MCS does not always begin severe. It progresses. Sensitivity increases over time with repeated exposure. Stage 1. Reactions begin: mild irritation, headaches, fatigue, discomfort around strong chemicals. Symptoms are intermittent. The connection is often missed. Stage 2. Sensitivity grows, more substances trigger reactions. Lower exposure levels required. Common environments begin to cause problems. Stores, workplaces, public spaces. Avoidance begins. You begin changing your diet because foods can trigger reactions. Additives, preservatives, and chemical residues become noticeable. You identify what your body tolerates and what it does not. Diet becomes controlled. Stage 3. Multiple systems are affected. Respiratory issues, neurological symptoms, inflammatory response. Reactions intensify, recovery takes longer. Daily life becomes restricted. You begin avoiding bathrooms, showers, areas with moisture, enclosed environments, because humidity carries contaminants, mold and residues increase exposure. Confined air builds concentration. Basic routines become risk. Stage 4. Tolerance collapses. Minimal exposure triggers reaction. Environments become unsafe. This includes indoor air, buildings, vehicles, clothing contamination. People carrying exposure. You are forced outdoors. You cannot safely enter most structures. This is survival mode. At advanced stages, the nervous system is highly reactive. Trigeminal pathways amplify pain. Autonomic responses become unstable. Inflammatory signaling activates rapidly. The body reacts immediately and intensely. Pain can be severe due to nerve involvement and amplification. Facial pain, head pressure, systemic distress. Some patients report pain levels comparable to extreme nerve conditions. This is not mild discomfort. Recovery is prolonged. Hours become days. Days become weeks. Sometimes months. From a single exposure. At this stage, loss becomes real. You lose friends. You lose community. You lose normal interaction. Support becomes limited. Even medical systems may not be equipped to handle the condition safely. Access to care becomes difficult. At this stage, normal life is not accessible. Movement is limited. Environments are restricted. Everything depends on controlling exposure. This progression is driven by repeated exposure, increased sensitivity, lowered tolerance. This is escalation. This is MCS progression. This is how it develops. This is chapter 5. System failure. The system is not built for this condition. There are no standardized protocols. There is no universal training.
Hospitals are not safe environments. They contain disinfectants, cleaning chemicals, fragrances, synthetic materials. These are triggers. The place designed to help can cause harm. Medical staff are not trained to manage chemical sensitivity at this level.
Controlled low-exposure environments are not widely available. Care becomes limited or inaccessible. Standard medical care relies on chemical-based systems. This includes anesthesia, medications, sterilization processes, synthetic materials for severe sensitivity. These can trigger reactions. Many procedures depend on chemical sedation, general anesthesia, controlled indoor environments for some patients. Anesthetic agents may trigger reactions. Additives and preservatives may not be tolerated. This limits the ability to safely perform procedures. Medical environments are built for sterility, not chemical avoidance. Exposure sources include disinfectant, sterilization chemicals, synthetic surfaces. These conflict with low exposure requirements. Many conditions have systems, defined protocols, trained specialists, structured treatment pathways, support networks. Conditions such as cancer, chronic illness, recognized disabilities have frameworks for care. For severe MCS, protocols are limited, environments are not compatible, support systems are inconsistent. There is no clear blueprint for safe treatment. At advanced stages, patients can become separated from care, not by choice, by limitation of available environments and protocols. To reduce exposure, some individuals must control environment at extreme levels because indoor air is not tolerable. Common environments trigger reactions. This may require isolated environments, outdoor living conditions. This is not preference. This is necessity. At advanced stages, loss becomes extensive. Loss of environment, loss of access, loss of normal interaction. Support systems can break down. Friends cannot adapt. Family cannot tolerate the restrictions. Contact becomes limited or disappears. The result is isolation, not by choice, by necessity. The condition can become overwhelming. Constant exposure risk, limited safe environments, prolonged recovery. The burden is high. Not all individuals reach advanced stages of adaptation. Without support, safe environments, and understanding, the condition can become difficult to manage. This reflects the severity of the condition. This is not a failure of the individual. This is a gap in systems, infrastructure, and awareness. This is system failure. This is why help is limited.